Is PRP an effective treatment for skin damaged by laser? If skin has been damaged by laser or any other skin rejuvenation treatment, can PRP help reverse or even help with the damage such as sagging, hollowing, or orange peel texture skin?
Thank you for your question. You're asking if PRP can help reverse the damage caused by laser. And in further, you ask about sagging, hollowing, an orange skin type of texture to the skin after a laser or any other rejuvenation device. Well, I can certainly give you my perspective as someone who uses PRP a lot in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I can tell you that platelet-rich plasma has been a huge part of my practice. I'm the founder of Tricostem Hair Regeneration Centers, where we use platelet-rich plasma in addition to a material called extracellular matrix for hair loss. So the question is very relevant because I actually treat a lot of people who have had, quote, damage from laser and thermal energy devices. There's been a tremendous interest in non-surgical alternatives to facelifting procedures and skin rejuvenation procedures. And with that has become a lot of technologies which can overheat the skin. And when you overheat the skin, you essentially, at different levels, you cause some type of burning. But to understand what the role of platelet-rich plasma is in this type of treatment, as well as other modalities I employ, we have to go back to understanding what happens when skin is, quote, damaged by laser or thermal energy devices. Well, to begin with, when someone has, quote, damaged skin, very often their skin is very, very thin. Why is that? They've lost tissue. They've lost the epidermis, they've lost dermis, and the tissue underneath, the fat cells, and the supporting tissue is also diminished. So platelet-rich plasma stimulates the formation of collagen, stimulates the development of blood vessels. Basically, everything that's used for wound healing is something that is stimulated by platelet-rich plasma. So I do routinely use platelet-rich plasma. In fact, I've helped patients, such as one who comes to mind a lot, someone who's had recurrent infection in the face from an unfortunate situation with something called biofilm. I've actually helped with platelet-rich plasma as well as the use of platelet-rich plasma and other modalities. So I think that there's an opportunity. However, it is difficult to restore skin to its pre-treatment appearance. It's possible to improve. And I always say that use of platelet-rich plasma for skin treatment, whether it's for repair or for maintenance, is kind of like, in a way, like going to the gym and building muscle. You stimulate, you recover, you're a little bit better, you stimulate again. So when you think about platelet-rich plasma, don't think of it as a one-off single procedure. You think of it as a part of a global plan to help restore and revitalize the skin. It often takes multiple sessions in order to get a good outcome that helps your skin improve. But I can tell you that it has been remarkable, and it has been something that we have had tremendous success with. It all depends on where you start and the kind of observations we make as we're doing these treatments. But the key is to build up and restore tissue. And so I often will combine that with other modalities. But in terms of, let's say you talk about sagging, you're talking about maybe skin excess, or are you talking about skin quality? If we're talking about skin quality, PRP can help. If we're talking about skin excess, well, the only way to improve sagging is to lift. You also have to think about other ways to help improve the skin in appearance. In our practice, we do something called structural volumizing, where we're putting the material that was typically used for injectables such as a hyaluronic acid filler, and we place it at the level of the bone structure. And that way, we're able to restore volume in a way that looks healthy and balanced without putting stress on the skin. Typically, injectables are placed either within the skin in the dermis or under the skin. Unfortunately, when skin has been thinned, that does not end up being such a great thing, but when placed at the structural level, it can really make a difference. So, meet with doctors who perform PRP and get a sense of what they can offer you. A lot of times my strategy is more of a comprehensive strategy where, yes, a person has had a negative outcome from laser treatment or a thermal energy device or something where heat resulted in some kind of loss of tissue. There's a lot of ways to address these problems, but they always have to be customized. And ultimately, you want to be happy with how you look, both in the short term and the long term. So it's not unusual for me to suggest not only can we do PRP, but if we do fillers and other things to help you look better immediately, it's something where you can actually feel good from the beginning rather than to keep waiting and waiting for the effects of the PRP to really maximize. So I hope that was helpful. I wish you the best of luck, and thank you for your question.